Well, good morning and welcome back. When you hear radiation therapy, you probably think of cancer treatment, but at Doctors Hospital of Augusta, they are using low-dose radiation to help some patients with osteoarthritis pain. Joining us this morning is Dr. John Stewart, a radiation oncologist, to explain how it works and who it can benefit. Good morning, John, and thank you for joining us.
Thank you for having me.
Okay, so my first question I want to ask is, what is radiation usually used to treat?
Radiation therapy is a local therapy, which means it shines on the patient like a light, and typically it's used to treat cancers. We treat many different cancers in the body with radiation therapy, and the dose that's needed sort of depends on which cancer we're dealing with. But it can also be used for benign conditions.
Right, so you talked about those benign conditions, and now we're talking about treating a form of arthritis.
Right.
So what does this low dose of radiation look like in treatment processes for a patient, and what are the risks and benefits of it?
Sure. One of the main reasons people have pain in arthritis is inflammation. So arthritis is a degenerative condition. The cartilage wears down, but there's a lot of inflammation in the joint as well. And when we give radiation at a low dose, it's about 5% of what we give for a cancer. It quiets the inflammation in the joint, and that can help with the pain the patient's having, similar to the way an anti-inflammatory medicine or an injection might help.
So, with radiation treatments, we know that there's a lot of procedures done while radiation is used to treat the cancer, but to protect other parts of the body of the person receiving treatment. Is that something that you still have to do with this lower dose of radiation for that arthritis treatment?
The radiation is very focused, and it's pinpointed at the joint we're aiming at. And so the most common joints that we treat are the knees, also hands, shoulders. Those are nice because we can treat those parts of the body without giving much radiation at all to the other organs in the body. And so it's directed at the place we're aiming, and very low dose of radiation to the rest of the body.
Describe to us for a second how often typical radiation treatments go for cancer versus how often you get radiation treatments for arthritis pain.
So the most common things we treat with radiation are the most common cancers in men and women. So prostate cancer and breast cancer. Prostate cancer treatment might be 6 to 9 weeks of daily radiation Monday through Friday. Breast cancer treatment similarly 4 to 6 weeks of daily radiation. Low-dose radiation for osteoarthritis is only 6 treatments. They're delivered every other day. It takes about 15 minutes, and it's an outpatient procedure that patients bring themselves back and forth to.
All right, so really cutting the time in half.
That's right. And
plus less radiation.
Correct, and the dose per day is much lower than what we might give for a cancer dose.
Yeah, so how long does this treatment typically take for patients to feel relief and feel better?
It's about 6 to 12 weeks after we finish, so it's certainly not an immediate relief. Patients don't walk out of the building feeling different than they did when they walked in, but it does quiet that inflammatory response it can take 12 weeks in some patients, and some patients that don't benefit from the first course, we can administer a second course, and about half of patients who are going to receive a benefit, it won't be until that second course 12 weeks later.
Right. Talk about the risk for patients wanting to try out this treatment.
Sure. It's something that wouldn't be done as a first-line treatment for arthritis. This is a treatment for patients who have tried injections, anti-inflammatory medicines, but maybe can't have a surgery or aren't ready for a surgery yet. The risk is very low in the place that we're treating. I mean, you don't get the skin redness, peeling, doesn't make your hair fall out like other cancer treatments do. The risk of that is theoretical, is radiation exposure producing a cancer or causing a cancer. What we can say is that this treatment has been done for decades in Europe prior to it becoming more mainstream in the US, and that increased risk of cancer really hasn't been seen when we do it in the right population of patients. This is not something that's right for a 40-year-old or younger, but this might be something more appropriate for folks in the later decades of life.
Absolutely. Thank you so much, Dr. Stewart, for coming in and for educating us. I just love to hear about the evolving times of our medical industry and what we are being able to do with science. So thank you once again for being here today.
Thanks for having me.
We are going to go ahead and toss it over to Jay to take a look at our forecast. Jay, what's the weather looking like?